Bismillahirrahmanirrahim. A brief introduction of neonatology. Neonatology, as the name indicates, neo means new and the word natal is related to birth. So neonate is a newborn, and it is defined as the first 28 days of your life. Roughly you can say a month. And this is further divided as early neonatal period and late neonatal period. Early neonatal period are the first 7 days of life or the first week of life, and the late neonatal period is the rest of it, that is 8 to 28 days. Now a few definitions about the periods. These are like perinatal period, prenatal periods, and the postnatal period. Perinatal period, peri means around, so this is a period of time before and after the birth. Before the birth is the age of viability time, from 24 weeks, including the birth time, and all 7 days after that. So the whole of this is included in perinatal period. Prenatal period, the word pre means before birth, so it is from 24 weeks of gestation to birth. And postnatal period is from birth to 7 days or early neonatal period. And the whole of postnatal period is from birth to 28 days, which is, you can say, is the neonatal period basically. Now we come to infants. The infant is the first year of your life, 365 days. And this includes the neonatal period, as we all know. Now miscarriage is the expulsion of a dead fetus before the age of viability, that is less than 24 weeks old. And stillbirth, if it is expulsion of a dead fetus after 24 weeks of age, after the age of viability. Age of viability is that at that age a fetus can survive if it's born, right? And in developed countries the age of viability is 28 weeks because of the low standard of the neonatal nurseries and the ICU care that is provided. Now we come to a few basic definitions of mortality rates. Is perinatal mortality rate, as we all know, perinatal period, as we have defined previously, is from if there is death of a fetus or a newborn from 24 weeks to till the 7 days of life. And neonatal is the death rate in the neonatal period. And infant mortality rate is the death rate in the first year of life, and these are calculated per 1,000 live births, like number of dead babies per 1,000 live births. Now, a very brief classification of neonates. Neonates are classified on 3 criteria. Number 1 is weight, number 2 is according to their gestational age, and 3 is, which includes both the weight and the age. Right? Consider them one by one. According to the weight, the newborns, they can be low birth weight, and initially you should know what is the normal weight. Birth weight is from 2500 gram to 3500 gram, or 2.5 kg to 3.5 kg to 3.5 kg, right? A low birth weight fetus would have birth weight less than 2500 gram or less than 2.5 kg, right? And a very low birth weight infant or neonate would have birth weight less than 1.5 kg or 1500 grams, and here before 2500 gram, right? And extremely low birth weight is even less than 1 kg, is less than 1000 grams. And then there is an incredibly low birth weight is less than 750 grams. It's not that important, but you should remember the first 3, right? This was according to the weight. Now we come to the age, gestational age. Gestational age is from the last normal menstrual period till the birth of the fetus, birth of the neonate. This is the gestational age, and according to the gestational age at birth time normally is the term period. Term is if the neonate is born at 37 weeks to 42 weeks. This is the term period. If it's born in between this period, it's a full term baby. then this is normal. And if it's born, if he or she is born before this term, that is before 37 completed weeks, you should remember they are completed weeks, not the days even, then this is preterm. And post-term if it's after 42 completed weeks of pregnancy. So this was according to the gestational age. Now we come to the criteria which involves their weight to the age, right? So infant may be preterm, but his weight may be according to his gestational age, right? So they may be small for their gestational age, that is their weight is less than that should be according to their gestational age, right? And appropriate for gestational age means that their weight is according to their gestational age. Like they may be preterm, but their weight is according to their gestational age. And large for gestational age simply means that their weight is more than their gestational age. More than that should be according to the gestational age. And this, if you be more specific, weight less than gestational age means that it's less than 10th centile, and weight more than large for gestational age is more than 90th centile. So the normal is appropriate for gestational age if it's between 10th to 90th centile, right? Let's discuss this concept further, like weight according to the gestational age. Like what is the gestational age, and at that gestational age what should be the weight. So we plot age and weight. Now if fetus is if it has a normal weight like 2500 gram at birth, and he's also a term baby, like between 37 to 42 weeks, suppose we considered 40 weeks, right? So his weight is according to his age, right? This is normal. Okay, this falls in between the 10th and the 90th centile, right? Now, but if the upper limit was 3500 grams, right? So the 90th centile would be at this level. And the term was up to 42 weeks. So this would be the 90th centile, right? Between the 10th and the 90th centile is normal. And below that would be small for gestational age, right? In between this, that is 10 to 90th, would be normal if their weight fall in this category according to their age, appropriate for the gestational age. But if it is less than this, less than 10, so this is small for gestational age, and if it is more than 90th centile, it's larger for gestational age. So this was a basic introduction of neonatology.